Hey Facebook friends, we're back for our last quarter of Facebook Fridays, and today we're starting off our Facebook Fridays with PDO Threading, which is a new service that we launched at our annual Spring Fling in May, and I'm really excited to show you this service. It's one of the hottest trends on the aesthetic market, as well as it's great for men and women who are not really looking for that surgical option, but would like a non-surgical neck or facelift, or we can actually do pretty much almost a lot of different body parts. So we're here to learn about this, and today I'm joined by our nurse practitioner, Kelly Hedges. Hi, Kelly. How are you?
I'm good. How are you?
Good. So tell us a little bit about what we're doing today.
So PDO Threads have been around actually for a long time. The technology is advanced now to the point where we're getting amazing results with these. So the PDO Threads, PDO stands for Polydioxanone. It's an absorbable suture material. It's actually the same exact suture material we would use in any of our surgeries, cosmetic and reconstructive surgeries. So the suture material absorbs into the tissues, usually over a period of about 6 months. The results, though, with the lifts that we're doing, the threads, are going to last anywhere from 1 to 3 years. You never really return to a baseline because these threads stimulate neocollagenesis. In other words, they stimulate the body's own reparative system, stimulate your body to repair its own collagen, build collagen, and improve elastin and tighten the skin. So you're never going to go back to where your baseline was. So when we say your results last 1 to 3 years, that means just, in 1 to 3 years you may need a touch-up. But again, you're never going to go back to baseline.
Perfect. So today we have our lovely, lovely patient. He is a beaut. So Lee, tell me a little bit about why you're interested in PDO Threads.
Yeah. Over the years, I've noticed I lost some weight, and now I got lines kind of sagging a little bit on my neck, and I'd like to, obviously lift them up and spread them out and
make you look younger for your new wife.
That would be awesome. Just tighten it up.
We see that a lot, especially with weight loss, men and women. This is a difficult area to treat. We do have other modalities, different options to treat the area, but it is a very difficult area to treat, but we've had a lot of success with the PDO Threads. But in addition to the PDO Threads, we also offer face tight. So these modalities together are going to achieve best results.
Perfect.
With this, especially with this difficult area.
So Kelly went ahead and numbed Lee right here.
So what we do is, initially you'll see some of my markings here. So these are where our barbed threads would be used. So our barbed threads.
Let's show those. What are barbed threads?
So barbed just means that they have actually small barbs on the threads. You can't see it here because it's in a sterile cap. But the thread is the blue. You can't see blue lines under the skin once they're placed. It's just for visualization during the procedure. But they actually can have tiny little hooks on them that you can't really see. But that's going to enable the tissue to then hook onto the suture. So we use an entry point here, and then that's what you see. It's blanched from the numbing medicine. But then we tunnel in the subdermal plane underneath the skin, and then we pull on that thread as we're positioning that tissue over those barbs, so then it gives us a lift. You can expect about 1 centimeter to 1.5 centimeter correction or lift from those barbed threads.
Now, are these suture, do they dissolve?
Correct. Yes,
okay.
Over a period of about 6 months.
Now, this might be a question, because this would be a question I would have. Like, if you don't like your result or you want a result change, can these threads come out?
So they can be removed. It's not, you don't want to it's not something that you can just say, I don't like it. Typically, if it's quick enough, I guess not to say quick enough, but if it's if you have a complication, for example, if it's puckering, those threads can be removed if you make a small incision and then you take the thread and pull it out. If it's 3 or 4 months down the road, as it's already starting to absorb, that's more difficult, so they can't be removed at that point.
Perfect. Okay, so let's go ahead and get started, and we can talk while we're doing it. Sure. That way, and we have a lot of people watching, which is wonderful since we're back live. And you guys, if you have any questions during this live, make sure you comment them, and we'll try the best to answer them. So we do have difference between barbs and threads. So Kelly's going to kind of try to explain that when she is actually threading.
Sure. So we've already kind of explained a little bit about the barbed threads. We also have threads that are smaller, that are shorter threads that we use. Some of them are, we call them coiled or screwed. They're actually coiled very tightly. This is just a skin prep to cleanse the skin. They're coiled around the needle, and the point of that is to fill areas. So when the needle is inserted, that thread stays in place. You pull the needle out, and that coiled thread springs open. So that allows what get that filling effect. So we use those within the deep line. So you'll see me when I'm talking about coiled or screws. We're going to go in these deeper horizontal lines to kind of fill those lines from underneath. Then we have smooth threads that we can actually lay almost like a foundation. It's a meshwork that we create when we go in different directions.
Kind of like a cross pattern.
We're kind of cross weaving them or meshing them in order to, again, lift that skin and tissue and to build that, because then those areas will kind of continue to stimulate collagen growth and tighten as where we're meshing, so that will tighten the skin. So you'll see
Perfect.
These are different.
And a lot of times people don't know is these threads can be used on your face, on your knees, on your stomach, your love handles, your bra rolls. There's a lot of different places. I know that people really like them for their knees, because a lot of you have that crepey skin that you can't get pulled up. The threads are perfect for that.
So right now I'm just creating an entry point for one of the barbed threads.
And sometimes some pinpoint bleeding is normal as well, so you might see that.
And that's a lot of the reason why this procedure is very popular. There's not a lot of downtime with this because there's minimal bruising, there's minimal discomfort. It's a fairly quick procedure. Typically, depending on the amount we're threading, these procedures can be done in a half an hour to an hour's time, depending again on the area that we're treating.
And my favorite part is she's going to basically outlay all the threads, and then she's going to pull them, which is going to be the fun part. So you can see she's starting to layer, which I love that part. How are you feeling, Lee?
Great. I don't feel anything. Painless.
So this is actually our first barb here. I usually tell the patient, like, you're going to feel some pressure, but any sharp pains, they should let us know.
They're telling you that you need to speak up.
Okay.
Kelly's very soft-spoken, so sorry about that, you guys.
And you'll see me kind of feeling for the tip of the cannula as we advance it. Doing okay?
Oh yeah.
Nothing sharp?
Nope. Just pressure.
And that's one. So then you can see when we pull on the thread, you can see the lifting action that we get.
Ooh. We're going to go home and watch this.
Yeah.
So now you're going to see me kind of engaging the barbs, and Lee's going to feel some, almost feels like kind of a crackling. I kind of liken it to like crunching a bubble wrap, almost, as we engage those barbs over that thread.
And I was so excited to watch this live because I actually was running around like crazy at sprinkling, so I didn't actually get to see it live on stage. So I'm actually very excited that I'm filming it this time. Kelly, where do you see, where do most people actually want threading done?
I think the majority of procedures we do are mostly the face.
Mm-hmm.
We have done several on the anterior thighs. We've done, Dr. Downs also does the procedure. He's done actually some really nice almost butt lifts
Okay.
with the procedure with the threads.
And you can do this for hair, correct?
Oh yeah, yep. So we can actually do a nerve block called a ring block to anesthetize the scalp in order to place the threads in the scalp. Again, part of the mechanism of how they work is they stimulate that collagen in the reparative cycle. So that's what helps to kind of stimulate those hair follicles to grow.
So now you're putting in another barb. Is that what you're doing?
Correct.
Okay.
So it's all about angles and vectors, and so your skin doesn't always sag in the same direction. So you need to pull in multiple directions in order to get the best lift. So that's why you see my markings kind of, you can see it even on the other side,
Mm-hmm.
where they're going in different angles.
Some lady, I don't know who she is, she says, "Hello, hubby, doing great."
Who would that be?
I have no idea.
Is there different gauges too?
Correct, yeah, very good question. So the barbs are usually a larger gauge thread, again because they're doing more work. They're lifting the tissue, so they're going to be a larger gauge.
Someone said, "Can you feel the threads after they are inserted and numbing medication wears off?"
So you don't necessarily feel the threads. You will feel like a pulling sensation. Usually patients describe it for the first couple of weeks after the procedure. They'll feel that pulling. Sometimes you can get little sharp twinges. Again, not usually over the first couple of weeks as those start to absorb. And so again, you can see as I pull on that thread, the lifting of the tissue there.
Now, one thing I've noticed with Lee, no offense, Lee,
Okay.
but like he has these very deep wrinkles.
Right.
Will those wrinkles go away with
So
threads?
you're going to soften those. So again, that's where I'm going to put those screwed threads in, because those are coiled and those are going to fill those deep lines. So that's where we would put those coiled threads.
Okay.
Then we're coming with those smooth threads and creating a meshwork. So we're going in this direction and this direction, and they're crisscrossing each other. So those are also going to help to lift those out. But in addition to that, over the next 6 months, that collagen builds, which will continue to fill those lines and tighten the skin, thereby improving that. And he's going to get some lift with these barb threads, so that's going to help with the submental area and tightening here. So that they work in combination together, which are going to continue to smooth those lines. Correct.
Perfect. So we'll continue to watch. If you guys have questions, keep asking them during this feed. I know Kelly still has a lot of threading to do, and she has the other side. So she works one side, and then she'll work the other.
Correct.
And for those of you who are wondering, those threads will not be sticking out the whole time. And also, Levine's in the room, so if you guys give a shout out, Levine is also helping us.
Hello.
Levine, how long have you worked here?
17 years.
17 years. Wow. Bless her. She's been with the doctors that long.
So now you'll see us kind of pull tight on the thread. And you're going to see a little pucker there that then we can come back here again and really engage those, and he's going to feel all that, and you see that just disappear in about, that's how we got that really nice lift there.
Wow.
That is so painless, it's not even funny.
Yeah.
I mean, I don't even feel that.
So this is the part that you can almost see like the little barbs down at this end.
Oh, yep. Hold on. I'm adjusting. Yeah, I can see them. I don't know if you guys can.
Down at the end here.
Mm-hmm. Really cool. Actually, you can already see a difference.
Yep.
From
Sometimes
this
we like
side
to
to the
show patients like their one side before I've done the other, so just so they can. It's nice. We like that instant gratification. So I love this procedure because patients walk out seeing the difference right away. They feel better right away, and it's really helped to really define his nice jawline there.
Yes. So now she's going to move to this side. I haven't decided if I'm going to move or not, or see if this is a different angle. I'm good with the lighting. You guys tell me differently. If you can't hear us or if the lighting's not good, you guys tell me.
Just to close the entry point here. So I'm going to make the entry point. Anything sharp there?
Nope.
Now, Kelly, if someone is interested in this procedure, do they just make a consultation with you?
Yep. Again, Dr. Downs and myself both do this procedure. We trained together in New York. So we both, we probably do between us probably 6 to 10 of these a week. So consultation with myself or Dr. Downs.
And Dr. Riscardi's getting trained very soon as well. Now, is there a fee for consultation that you're over?
Do you know if there is? I think there is.
Fee.
So there's a $50 fee. Levine.
It's credited to
So if
the
you do
procedure.
book, yeah, correct.
If you book.
So Levine says there's a $50 fee, and then that goes towards your threading.
You can't even feel that. That is so painless. Wow.
Now, did you numb him all the way up his neck?
Oh, just at the point.
To the point,
She
okay.
has, yeah,
Yep.
then you-
It is fascinating, Susan.
But he does have some where you see the white cream on his neck.
Yes.
It's also topical numbing, yeah.
Mm-hmm. Did you do all topical numbing?
No, this the entry points where I just put the entry needle. Those were injected.
Okay.
With a local numbing.
Okay. And this is done in our procedure room, so you don't need to go to the OR for this. This is done right in one of our...
And you don't need to fast. You can drive yourself to and from the procedure. Usually the activity precautions depend on the body area being treated. For any body threads that we do, we tell you like no strenuous activity to the area being threaded for about a week. For Lee, just 3 days, no strenuous activity.
Oh, darn. Hear that, Colleen? You gotta do some work.
The honey-do list. It's all hers.
You okay there?
Yeah. Can't feel anything.
Now, should they watch any type of ibuprofens or fish oils or anything like that?
Right, so we give you, it's a lot to remember, so you do get a full post-care instructions. But we tell you like no blood thinners or aspirin, ibuprofen for like 3 days after the procedure.
Now, can you feel the threads? Like, because you know when you have like injections, I'm gonna give like a lip injections. I can feel the product. It can be a little bumpy. I can feel it. Is there any like type of pain? Can you feel it? Swelling? Anything like that?
The swelling is normal. Usually that pretty much resolves within 48 hours. Again, you're not going to necessarily be able to touch and feel the thread as much as you just kind of feel that pulling sensation. So again, you can see that pull that we get there.
How fun is this?
My favorite part is feeling the crunch when I get to pull the skin back over the thread. It's like that satisfaction you get with the bubble wrap.
Mm-hmm. Is there any bruising at all?
Usually, typically, the only bruising you'd see is right there at that entry point, but he didn't really bleed at all, so I don't anticipate much bruising or anything like that for him.
I know you guys are like me, just watching right now. If you have any questions, Kelly is here to answer them, or even questions for Lee, who's sitting here. He's happy. He's happy to answer.
Just ask.
Yeah. He even dolled himself up for y'all. And I love that we're doing this on Lee, who's a male, because I think, you know, men are ones to kind of, you know, want some things done, but they're not sometimes openly admit it. So thanks, Lee.
No problem. I mean, I recognized this years ago, and I mean, I'm glad they have a procedure to fix it.
Mm-hmm.
You know, one thing about the Center PC is, you know, we are definitely one of the leaders when it comes to procedures. And, you know, we are, you know, in the plastics industry. So dealing with, you know, bodies and faces, that's kind of our go-to. So you definitely, if you wouldn't want to come to us or want to go somewhere else, make sure you're going to someone who is trained, who's in some sort of the aesthetic arena, such as a plastic surgeon, a facial surgeon, dermatologist, that kind of thing that's dealt with, especially in the face part of it. But ideal to be in plastics or facials. And make sure you're doing this from a nurse practitioner or a physician as well. I don't even know. Can nurses even do this procedure?
I don't believe so.
Okay.
And then, you know, we like to be on the cutting edge of these procedures, so we do a lot of research
Yes.
into even the vendors that we use, the products that we use. We, of course, go to training. We keep up our certifications. Again, see that nice lift that we're getting there. It's really helping to shape that jawline and pull this nice and tight.
Oops, sorry guys. Flip to me. Trying to zoom
Those
in.
are really important to make sure, you know, we don't just start doing treatments without really doing our homework.
And Kelly is also you are a plastic surgery nurse as well.
Correct. I have my certification as a plastic surgery nurse.
Which took a lot of time and dedication. And I remember when you taking the test. I was there.
Exactly, yeah.
I was there for cheerleading and moral support. I'm really good at that.
I'm also board certified in anti-aging medicine.
That's right, you are. That's very new. I mean, you've had it for a couple months now.
I'm excited to see the results.
Yeah, it looks really good.
Like the tug, yeah.
Wow.
Again, you see like this nice pucker here. And then again, we can pull and you'll hear maybe the crunching. And we just lift that and smooth that over that. You get to be almost an artist.
Yes, very much so.
There you go.
Can you do this with your breast?
Yes, actually we, patients that have had a reconstructive breast surgery, you know, they're not left with a lot of breast tissue. So sometimes they, really have, especially for patients that don't have a lot of body fat or breast, they don't have any breast tissue. In addition to that, they don't have a lot of body fat, so they're left with really just skin over implant. So sometimes they can have, some hollowing out of the upper pole, where they have that kind of a volume deficit. So these threads, again, they help build collagen. So we've had a lot of success with just kind of helping to fill in the upper pole of the breast. So we've actually, Dr. Downs has done several procedures with reconstructive patients where he's been able to do some nice contouring with the threads.
That would be an awesome Facebook Live. So now you've done the barbs. So now you're going to go to the smooths.
Right. So
Okay.
now I'm just kind of wiping off that
Numbing cream.
numbing cream. So in addition to some of the other restrictions we talked about, so we would have Lee not do like any facials, treatments to the area. I know with patients that have had threads to the face, we tell them no facials for 4 weeks after the procedure.
Okay.
We can combine this with other procedures, like Botox is safe to do. A lot of the times these threads are combined with other modalities, because again, that's when you're going to get your best results in combination therapy. So like Botox, for example, will help to, threads will help to lift, but Botox is going to help to smooth fine lines and wrinkles. It's also going to prevent you from continuing to make those fine lines and wrinkles worse. Fillers, so if we're talking about the face, so the threads can help us to lift. I'm just pointing at you, for example. I'm not trying to say.
No, you're good. You're good.
But fillers are a nice way to kind of add volume to the cheeks. So in addition to lifting, you're going to restore that nice V shape to the face.
Yep.
So again, combination treatments.
Agreed.
Are
Because what happens a lot of times is you're I feel like this is kind of something I can talk on with fillers is you kind of sunken in. So yes, threads are going to help lift, but a lot of times once you've lifted, and I've said this with facelifts as well, once you've lifted, that doesn't volumize, give you the cheek or, so the volbella, the volumas, those are going to give those volumes back to your...
Right, which is really nice in the mid-face. In addition to that, good skincare products and regimens. If you want something with retinols to help turn over,
absolutely,
things with hyaluronics to help add moisture to the skin. So products are a good way of maintaining your results. Like you don't go out and buy a new car and not put insurance on it, correct? So these are ways of making your results last longer. So when we say 1 to 3 years, doing all those things can get you the 3 years.
What about laser procedures? When can you have a laser procedure?
So that's 6 weeks after this. Because again, those threads need time to absorb. And we want the tissue to stay where we put it, especially with barbs. So if you went and did a laser or something that uses radio frequency or heat, it puts heat on the skin, that could start that absorption process too early, and then you're not going to get those results that we want. So we say 6 weeks after a threading for a laser procedure or any RF procedures with radio frequency. Or you could do those procedures first, again, to prepare the skin for your threads, and then follow it almost immediately with threads. Correct.
Okay.
So now you're going to see us, actually, Living, can I have some 29-25 screws? Okay.
Thank you, Levine.
Welcome.
Putting that 17 years experience there. Yeah. Love it.
Good plug there. So now you're going to, again, so I've just wiped off the numbing medicine and prepped it with the ChloroPrep. So you're going to see me come in through these deeper lines, again with these coiled or screwed threads, which again will kind of help to fill in deeper lines. So the thread is there, so you'll see me sometimes lining up where I want to go. And then I make an entry point, and again, it's just in the subdermal plane.
This is my favorite because it's so fast.
Yeah, you'll see it start to go a little quicker with these.
The barbs just take a little bit more concentration. What is like price range for threads?
So again, it's going to depend on the body area. Typically neck is going to be anywhere from $1,500 to $2,500.
Okay.
Sometimes you can combine, like if you were doing a neck and face, full face, I think there's some discounts. But everybody is kind of quoted individually, again, depending on the body area
Right.
treated.
And how much laxity of the skin you have.
Correct. But we don't quote by the thread.
And we have kind of how you can, and I'm going to keep threading, but I'm going to show everybody my own little version with Lee's face, is we kind of have what's called a 2-finger rule. So if it goes back 2 fingers, it needs to be threaded. But if it's more, let's use your forearm like this.
You're more of a candidate for
Sorry.
a face lift.
Yes. Sorry, Lee, did that hurt? So kind of keep that in mind. So 2-finger rule.
And that's why we see you in consultation. Because we can, talk to you, and set realistic expectations about what we can achieve with the threads. Sometimes with a new procedure, there's a tendency to want to try and use it to treat everything when there's things that have are more indicated. The example you've heard me mention face height as well. So this is another area that's very does very well with our face height. But again, that combination treatment, face height with the threading is where we see best results.
And you can even do this for your lips
Oh yeah.
to give it kind of a little bit of a roll. If you're not interested in getting filler, this is another option.
I have also had several patients that
Do both.
have for example, I had a patient that had smoked in the past, so she had fine lines, lip lines, and we were able to treat going along the vermilion border, really pop those out, and she achieved a really beautiful result with that.
But the one thing I want to point out with PDOs is it's not going to give you volume. So if you were looking for volume in your lips and you need to do something like a Juvederm Ultra or Juvederm Volbella, it's not going to give you that. However, it's going to help soften those wrinkles and tighten that skin. And as well as it's not going to help you with the texture of your skin as well. So that needs to be where you're going to have...
Somewhat with texture as it helps repair collagen and all that. So you will get some, but
at the end of the day, you need to be on medical grade skincare.
Yes.
That's what's really important. And just like Kelly said, it's protecting your investment. You're not going to buy a brand new car and not get car washes.
right? I like those analogies. So now I'm going to start doing some monos. So you're going to
Yeah, and I want to see if I can get close up to the
come in
threads.
crisscrossing motions.
You see those threads? How awesome they are? Wow. Someone says highly.
Hello.
Good thing your voice didn't crack. So are you guys excited? We're back on Facebook Lives. We've been off pretty much all summer.
Oh, really?
Yeah, I know. I know they've been missing my face. This is my favorite part right here.
This is?
Yes.
See them poking out?
Yep, she's going to line them all up and then she's going to go vroom, vroom, vroom.
Shana has lots of sound effects.
she does.
You guys should just work with me. I'm a treat.
It's just amazing. I can't even feel that. You even doing that?
And I typically will see patients back, usually about 2 weeks after a procedure, to kind of look at everything. So this is Shayna's favorite part. I'll stop here for a second.
Boom. Boom. This is my favorite part. You gotta do 2 at a time.
Getting fancy.
And can you show me one of those again? I know you have them out. I'm getting more.
I'll take the cap off of one so you can see if the thread's kind of coiled around this needle.
Can you turn it sideways? Is that possible? Oh yeah, there we go. I can see it. Can you guys see it? Especially when she moves it. You can see when she turns it. Oh, we know what family is.
Running through.
You're finally. It's your long legs.
Yeah.
Turn up just a little bit before you go. So again, you're going to see us kind of crisscrossing things here.
Again, and you guys can see, really, he's had no bleeding at all. I mean, I don't see any bruising at this point. Really great.
Sorry.
You're fine. Your hair's so soft, though, Kelly. And for those who don't already, make sure you subscribe to our Facebook page, like it, our Instagram, which is at the Center PC, and our YouTube channel. You can kind of follow us for specials, for videos, for information going on in the practice. It's really great, especially our YouTube channel. We put up a lot of videos there. We mainly do some of them here. Instagram, we kind of do more of like daily things with the Instagram, which is awesome. So make sure you guys subscribe to all of those, and you can kind of see what's going on and what's new at the practice. And it kind of also keeps you up with the trends as well.
So you started to hear me say, I typically will see patients back about 2 weeks after the procedure, so we can look at everything, again, make sure, especially if we're doing anything to the face, that everything's nice and symmetric. And then if we look at everything and we decide, okay, this area needs touched up, or we're a little asymmetric here or there, we want to add something, or sometimes people, they sleep on one side of their face, so the lines are a little deeper on one side more than the other. Then we have them come back in about 4 weeks, so 6 weeks from the initial procedure. And if we have to do any kind of touch-up, any minor touch-up, that's not an additional cost to the patient. That's covered under their initial consultation and booking.
Okay, can you do liposuction for a double chin? Yes, we can. Oh, so I love that your name is Jujubee, because I think of the song Juju on the Beat. Isn't that what it's called, Juju? Juju on the Beat. Juju, right? Lee?
Don't ask me. I'm a 70s child. I don't know what that is.
I'll listen to country. I'm not sure.
Right, Libby? Yeah, boys.
I do, but I don't know that one.
I think there's a song called Juju on the Beat. Or maybe it's Juju on the Beat. I don't know.
So again, you saw us you put the screwed ones into the deeper lines. This one is pretty much already lifting out the lower one. So this, again, is going to continue to build collagen and lift and tighten over time. So he's all done.
That's it?
That's it. You did it.
Wow.
Okay, so really quickly, we have a lot of questions coming in right at the end, and I will kind of do a little. So you probably already went over this, but can you explain the difference between the smooth threads and the barbs, and what is the crisscrossing she's doing now?
So the barb threads, you can kind of see on here. So these are a larger gauge. You can see those. Sorry, if I stop moving it.
Yep, I got them.
The barbs on there. So these we're going to use more for lifting. So this is what I would use in the
right here.
In the neck to lift and tighten. We also we really like using them in the cheeks and jawline. So usually you can get about 1 centimeter to 1.5 centimeters. Correction. Lee actually has really nice cheeks, so Actually has really nice.
Yeah, you do.
Thank you.
Lee.
So a lot of women don't like the deep nasolabial folds or marionette lines. So actually lifting the cheek as we age, we get what's called malar descent. So our cheek mass ends up, from gravity and aging, kind of descending down. So we get a flattening of the cheek, and we lose that nice S curve that we want to restore. And again, we want to restore the V shape to the face. So you're aiming to kind of correct that nice S curve. He's actually got a really nice S curve. So for
your cheekbones.
Right. So you would use the barb threads to lift. You're not going to see much lift on him because he doesn't need it. So you would lift here to really then pull that cheek mass back up.
And a lot of times too, they love them for the nasolabial folds too.
So women and men, we sometimes will get like a jowl, like a pre-jowl sulcus right here. So you almost get like a
kind of like right here.
Like this little thing as I get towards 40 this year. So a nice area to thread is right along the jawline. So again, helps with that jowling here. So we can put an entry point here and lift back this way. Again, to define that and pull that jowline.
And another thing I'm seeing a lot with threads too is kind of like a brow lift. So those who kind of have more, it's not you, Lee, because you're perfect. But they have kind of more of a hooding. You can use threads to bring that up.
Exactly.
Which is so awesome.
Yep. It works beautifully there. So those would be your barb threads. So smooth threads you're using more for smoothing and tightening the skin. So
for these deep etched in lines right here.
Deep lines we would use screws or coiled threads. So those are the ones that were tightly coiled around the. Actually, I have one here I can show. So these would be a coil or a screw. You see how tightly coiled it is around the
I'm trying to get I can see it in person. I don't know if you guys can really see it on camera because it's kind of.
When we insert the needle and then take the needle out, that coiled thread remains and springs open. So it's going to fill deep lines.
And you guys could see, if you guys kept watching the whole video, this actually had a really deep line, and look how it's already popped out. And this one is already, I can already see it starting to pop out. So I can see this will all smooth out.
All through these lines, and we also, the smooth threads, we came this direction as well as this direction, so that's going to build us almost like a scaffolding to again lift the skin, and that collagen is going to start to build, which is going to tighten and smooth, and it's going to improve the elastin in the skin. So not only does he have barbs working for him here, but he's got all of those monos and coils working for him here, which is going to help kind of smooth and
wow.
pull those lines.
And for the double chin, usually liposuction is a one-time surgery. It is a surgery, but we can also use face tight, which is something, so you can do a combination between face tight and this.
That size too, it can be done under a local anesthetic for liposuction, so you're not having to go under, so it's more minimally invasive.
Perfect. Well, thank you, Kelly. This is PDO threading. So if you guys are interested in doing PDO threading, which again you can do on your face, your stomach, your love handles, your knees, your breasts, arms.
On the back of the arm, you get that kind of laxity to the back of the elbow, so we can thread to kind of lift that as well. But basically anywhere in the body that you can use suture material, you can use these threads.
But we kind of do them like our BBL. That's kind of very common.
Yes.
Very common. Yes. So,
hair,
that's right. Hair is so many different areas. The inner knees, right? The inner thighs, all kinds. What does it help with cellulite? I thought I read that.
It does actually.
Okay.
The coiled threads you put right in those areas, and it almost acts to. So cellulite is caused from bands of tissue that are pulling down at the skin, causing that dimpling. So the needles actually will kind of cut those septae, so kind of release those bands. But in addition to that, we're using those mono threads, those smooth threads, to, again, lift and build the scaffolding, which is going to help to smooth the tissue, tighten the tissue, which, again, helps with cellulite.
Perfect. All right, so you guys, if you're interested, you can give us a call, and it's $50 for having a consultation with Kelly that goes towards your threads. Is that correct?
Yes.
All right. So you guys, thanks so much for tuning in to see us. We'll be back again next Friday. I'm actually going to be over in the spa. We're going to go visit those ladies. But make sure you subscribe to our Facebook, Instagram, and YouTube channels. We definitely have lots of videos over there with different procedures as well as specials. And we do have monthly specials going on right now over in our spa, including skincare, Restylane, Newtox, which we'll be doing a live very quickly on that. So that's one of the hottest toxins on the market right now, as well well as we have a Perfect Pout Day coming up. So thanks so much for watching, you guys. I know I'm back. I'm excited to be back for you guys. And if you guys have any questions, make sure you comment below and I will answer them throughout the week and weekend. Have a great weekend, guys. See you later.